So today we'll be demonstrating 3 stages of strengthening following an ankle sprain. This can be done using simple exercises with little to no equipment in the home environment. It is important to ensure that you have minimal swelling and pain in the area before you commence the exercise program. If you're curious about how to manage pain and swelling, please see the link in the description. An ankle sprain can lead to weakened muscles in the area simply due to inactivity. But in order to prevent this, we want to strengthen the muscles in the area, which can be done using a simple set of exercises. A stronger ankle means that it is more stable through movement and there's a reduced chance of re-injury. First, loop the TheraBand around the affected side while stepping on it with the other foot. You then want to bend the knee on the affected side to 90 degrees and rest the ankle on the thigh of the leg. You then want to use your hand to move your foot towards the ceiling. Once achieved, move your hand away and maintain that position for 15 seconds. And you want to do this for a total of 3 sets. For the next exercise, have both feet in front of you in a seated position with approximately a 70-degree bend at the knee. Then you want to loop the TheraBand around the affected foot and hold it in place with the opposite side. Use your hand to move your foot away from your body without rotating the lower limb. Hold it in place for 15 seconds for a total of 3 sets. For the next exercise, loop the TheraBand around the upper portion of the affected foot and move the ball of your foot away from you by using your opposite foot. Hold it in place for 15 seconds for a total of 3 sets. For the next exercise, loop the band around the affected side by stepping on it with the other foot. You then want to bend the knee on the affected side to 90 degrees and rest the ankle on the thigh of the leg. Then you want to actively move towards the ceiling into maximum inversion and back to neutral position. It should be done for a total of 10 to 15 repetitions for 3 sets. For the next exercise, have both feet out in front of you in a seated position with approximately 70 degrees bend at the knee. Loop the TheraBand around the affected side while holding it in place with the opposite foot. You then want to move your foot away from your body without rotating the lower limb in a controlled manner. And it should be done for a total of 10 to 15 repetitions for 3 sets. For the next exercise, loop the TheraBand around the affected side and move the ball of your foot away from you in a controlled manner and should be done for 10 to 15 reps for a total of 3 sets. The next set of exercises require no equipment. However, it is recommended that you have access to stairs and a sturdy railing to ensure safety. You want to do this while standing on a step with half your foot touching on the step while holding onto a railing for support. We then want to lower and raise the inside of your foot in a controlled manner. You want to do this for 10 to 15 repetitions once again for a total of 3 sets. The next exercise is quite similar to the previous one. We're going to stand on the opposite side of the foot this time while holding the railing for safety. Then we want to start slowly lowering the outside of the foot from the step and then return to neutral. Similarly to the previous exercises, this should be done for 10 to 15 repetitions for a total of 3 sets. The next exercise should be done in standing position with a nearby surface for support, such as a chair or a railing. You then want to lift your heels off the ground as high as possible and then lower your heels back to neutral. This should be done for at least 15 repetitions or more for a total of 3 sets. This concludes our video on ankle strengthening following a sprain. I hope you enjoyed the content and thank you all for listening. Please like and subscribe. See you next time.